and delighted that you can join us. We've got quite a lot to get through, and one of the things I want to do today is to try and give you all a break by finishing at 11:45, so you've got 15 minutes to grab a drink and maybe spend a bit of time with a colleague. I'll say a bit more about that near the end of today. So I'm going to try and help us finish by 11:45. Just to remind you that, again, today we're meeting as in a Microsoft Teams meeting, so can I ask everybody to mute themselves if you haven't done so already. You will be able to ask questions in the traditional way through the chat. You will also be able to ask us questions directly, and we'll leave some time for people to do that. And if we can go to the next slide, please. So here's what we're going to talk about today, but before I do that, I know that we're right in the teeth of the Omicron wave. And so all of us here on the call who may talk or answer questions today very much want to say again, thank you to everyone for all that they are doing. What you do to keep serving patients is truly amazing, and it is hugely appreciated, I know, by everybody out there. I often have the privilege of meeting people representing the hospital, and I know that the thing that they would want me to convey again to you all today is their immense gratitude for the work that you are doing. You can see today is pretty much all about COVID, and we'll go through a variety of different looks at COVID just to make sure everybody is up to date with the latest position, because as ever with this wave and with COVID more generally, the situation continues to evolve extraordinarily rapidly. So into the detail. Can I have the next slide, please? So here's where we are today. One of the things that I think it's important to remind us all of is this remains a worldwide pandemic, and I think the key point I find myself reflecting on as I look at this data is, and I know we talked about this during the course of last year, that one of the truly only safe ways for us all to move beyond this pandemic time is to make sure the whole world gets vaccinated, because that is the way that we get to some sort of maintenance place, and it becomes a little bit more like an annual vaccination like flu. We're not there yet. You can see probably only, although we are doing very well in this country for vaccination, 9 million doses in vaccine doesn't represent a fraction of the population across the world who need to get vaccinated, and we need to continue to support efforts, I think, across the world to try and make sure that that happens. We go to the next slide. In the UK, we passed a pretty grim milestone recently, with 150,000 deaths now being recorded. But you can see, compared to that 9 million, we are very well vaccinated as a country and getting ever more so. It remains, as I've said all along, the single biggest thing any of us can do to protect the NHS. And we're going to spend some time later on in this presentation talking through the issues around mandatory vaccination and what that means for us all. Could I just ask people to mute, if that, thank you. So the UK government data is here, and the best view we have of where we are at the moment is that the Omicron wave is peaking. We think that the rest of January is going to be very difficult, but we think that fast spike is likely to lead to a reduction in February and a return to a more steady state scenario. But I have to say, that one of the things that national colleagues were reminding of us on earlier this week is probably the biggest thing that we have to consider at the moment is that there is still a high degree of uncertainty. And when we talk on the more specific forecasts later on, you'll see that we are still planning for a doubling of our current position in the hospitals. And we have to continue to think like that, even if we slow down over the next few weeks. So that's the UK position, and we'll move on now to the Northamptonshire position. End of last week, we declared a major incident in Northamptonshire. There was a lot of press coverage on that. And the reason why we did that was, although our numbers in hospital at that point in time were not as significant as they were in either of the two previous waves, given the fact that we had significant staffing absences, given the fact that we had rising numbers of COVID patients, and coupled with that, winter pressures, it was pretty clear that we needed to do something to get ahead of that curve. What the major incident does.
I haven't ordered anything, so I'm presuming it's from Emily.
No.
Ashley, you might, yes, you might want to mute yourself. Good to know that you haven't ordered anything though. Right. And what it does is a major incident allows us to coordinate our resources, and it bolsters our ability to do that. It also allows us to prioritise the work that we do. And that is another key reason why we decided to call a major incident. So those 2 points, it makes us come together very regularly. So we're now meeting with health and care and wider public services 2 or 3 times a week to make sure that we are doing as much as we can to maintain safe services across the county. Because I should say that COVID is not just something that's affecting us in terms of staffing absences. Pretty much all of our partners have seen a similar pattern of difficulty in terms of maintaining their staffing. So that was the reason for doing it, and we will be giving an update press conference probably early next week to let people know where we are. But that was the reason for calling the major incident last week. If we can take the next slide. And now a figure well known to us all, Matt Metcalfe, just lost him there for a second. I'm sure the slides will come back up. Just talking a little bit about where we are and what's going on. I'll hand over to Matt on video, so to speak.
Hello, I thought I'd take a moment to talk to you about the system-wide major incident that was declared in Northamptonshire last week and is likely to be ongoing for another couple of weeks. So the major incident was called by all major health and social care providers in the county in recognition of the fact that none of us have the staff that we need to open all the beds that we would wish to across the county due to COVID-related absence, and that the pressure on those beds from patients, partly due to COVID, but also other diseases, is extraordinarily high at the moment. And the major incident is in particular a very supportive move by our system partners to help decompress the acute hospitals, ourselves and Kettering General, so that they can focus on the acutely unwell rather than those with complex care needs, but no need to be in hospital. So what I would ask of you to do in return for our partners is to make sure that those patients who no longer need our medical care are clearly identified on your ward and board rounds, that their EDNs and TTOs are prioritised, so that when the community capacity which the council and NHFT are bringing on stream for us as we speak, and through this week becomes available, we don't squander those efforts and miss the opportunity to place our patients in them. The only other ask is, of course, those patients who can go home and do not need the council or NHFT to provide support on discharge, then please make sure that we are identifying and discharging those as rapidly as possible. I think the key message at the moment is, if a patient does not need to be in hospital at the moment, then frankly they need not to be in hospital at the moment. We do not have the luxury of any other approach at this moment. Our partners are putting their shoulder to the wheel with us in a very meaningful way. I look forward to the fruits of that, and I'm immensely grateful to you for maintaining and sustaining the huge efforts that you are undertaking on behalf of our patients. Thank you.
Thanks, Matt. And I can echo the fact that those partners are doing their utmost, given, as I said, the very trying circumstances in which they find themselves. Now on to where we are now. So we've done the world, we've done the UK, we've done Northamptonshire, and now we drop down to, so what's it like in our two hospitals? And this is the latest hot off the press information. So I'm handing over at this point.
Thank you, Simon. So I'm Debbie, I'm the Hospital Chief Exec at Kettering. Good morning, everybody. So as you can see, both hospitals are still on a really high level of operational escalation, level 3, although thankfully NGH has managed to step down from level 4, which as a hospital has been on level 4 for a good couple of weeks now. So that's really good news. The number of COVID patients in both hospitals are still relatively high, but obviously from the graph below you can see that they're not as high as we've seen in previous waves of COVID. I do know that from an NGH point of view, that number is starting to decrease quite nicely now over the last couple of days. From a KGH point of view, we've had a few ups and downs over the last couple of days, but today that number has decreased again from 67 down to 65. As with previous waves, the majority of our patients are not in ITU, but we do have some patients in ITU, and you can see those numbers on the chart at the top. In terms of the forecast, you will have seen this information previously. So the total number of beds that are needed for COVID positive patients is on the left-hand side of the graph, and then on the right-hand side, you can see the predicted forecast. That large, well, it does look like a large turquoisey bubble on the right-hand side. So what that means is, right in the middle of there, you can see a very faint blue line. That is the most likely case for our COVID expected beds that are going to be required. Obviously, worst case, you start to see an increase, and best case, quite a significant decrease, down to numbers that we saw at the end of December going into early January. I think Simon said that the predictions are variable, so we do see this move on a day-to-day basis, and that's very much dependent on how many COVID admissions we admit, what's happening in the community with regards to case rates, and how many outbreaks we've had in each organisation. So it is fairly variable. And as was mentioned earlier, we are planning for worst case scenarios, so we are still planning to see a doubling of numbers in both acute organisations. And I'll stop there, and I think I'm handing over to Fiona. Thank you. Thanks, Simon.
Thank you, Debbie. Good morning, everybody. My name's Fiona. The first slide that I wanted to talk about is in regards to visiting. We've made a difficult decision across the two organisations to suspend our visiting, and this is to maintain the safety of our patients and our staff. Across both organisations, we've seen outbreaks associated with visitors who may have had COVID and potentially spread COVID. Just as we need to maintain our safety and that of our patients and use our LFTs, so we need to ensure that we limit our visiting so that we don't risk our patient safety. The guidance on visiting is listed on the slide and can be found on both of the websites for each organisation. There are exceptions, but this is on a case-by-case basis, and we are asking the public, family members, relatives, to contact the ward or department if there's a particular need for them or their loved ones. So while we have visiting suspended, please can I ask you to consider all the virtual options that we have to keep in contact for our patients with their loved ones, and in particular ensure that there is regular contact with relatives and carers for our patients, potentially on a daily basis, to ensure that there is that meaningful relationship and that compassionate caring that we want to provide on a day-by-day basis. If we could go to the next slide, please. So stopping the spread of, in particular, Omicron as a variant of concern, as Simon has said, we all have a part to play in this. And the most important part is about vaccination, which will be followed a little bit later. We know that the Omicron variant is transmissible and very transmissible, I should say. And it is the key principles of infection prevention that are listed that we need to take notice of, in particular within the organisation. The symptoms that are listed there under section 5 talk about a high temperature, a new continuous cough, and a loss of change of taste and smell. And what we've started to see with Omicron is also things such as a runny nose and the watering of eyes. So please consider these as part of the symptoms. The guidance, the national guidance that affects and applies to us as a healthcare provider has changed a number of times. So it is really important that if you have any symptoms or if you're in contact with somebody that has got COVID or had COVID, to ensure that you check your website. Both of our infection prevention teams have updated the flowcharts required to be used by staff and managers to support our staff back to work, or to consider what the next step is. But as it comments there, if you have any concerns, please contact our IPC chart staff on each of the sites. Moving on to the next slide, please. So the wearing of a standard surgical mask is imperative, and both organisations not only are supporting our staff to do that, both in clinical areas and non-clinical areas, but also in insisting that our patients wear masks. And we recognise that when you're particularly unwell with some diseases, this isn't possible or practical. However, we are encouraging this across both organisations. There's also been some discussion across both organisations in the use of FFP3 masks, which we now have much more available to us for those staff working in red zone areas. And again, both organisations have facilities by which you need to be fit tested for your mask. We all have different faces, different sized cheekbones and contours. So we need to consider that our masks fit us appropriately and safely and correctly. So please ensure that those masks are tested with the teams that can be found. The details can be found there on the slide for both organisations. And at that point, I'm handing over to Heidi. Thank you.
Thanks, Fiona. So I'm Heidi, I'm the Hospital Chief Executive at Northampton. So we just wanted to talk to you a bit about some of the discharge work. So it ties to what Simon was saying about the major incident and how we're really trying to proactively work with partners. It's fair to say there's some amazing work going across partners, which is a really positive thing for us in the system. So one of the really positive pieces of work happened yesterday at KGH, where they had a MAID event, which is multi-agency discharge event, and working really closely to look at individual patients, to really look at discharge processes and make sure every partner is doing everything they can, including us, in the most effective discharges we can in the context of the environment we're working in. Today at Northampton, we're having that same event. So really positive that we're proactively working and really making sure we're all really understanding, are we doing everything we can in the best interest of patients across providers and across pathways. Nationally, we remain on a level 4 national incident. So we do have regular regional and national briefings around what the national picture is and what that means for us and the requirements for us. So there's 2 areas they really want us to focus on. One is we really focus on getting patients home who don't need any social care support or any community care support, and they can go straight home. So in Matt's video, he referred to those as making sure we really concentrate on getting people home as soon as we can, because obviously if they don't need to be in an acute setting, it's safer to get them home. So that's a piece of work we're really concentrating on, and both hospitals obviously have some really focused work on that. The second area, and that we've been given a number that we need to reduce our beds by, and it's different in each patients by, in terms of those that don't meet the criteria for the reason to reside. Some of you may hear it's similar to the medically fit for discharge, slightly different, but essentially it's meaning that those patients no longer need acute care and need either a social care or community care or similar package to enable them to leave the acute setting. So that's where we're really working with partners to really make sure we're sharing the risk of the major incident that we're in, but also we're working really collaboratively. So one example will be social care and NHFT, who were on site NGH for a meeting here to make sure they really understood what the blockers might be coming out of Northampton, and they've done similar things with Kettering. So it's just really to make sure you know that we are doing everything we can to truly understand the pressures you're feeling internally within the hospital, and making sure that we are tied into the system, regional and national conversations to make sure we're really thinking differently, working collaboratively, and really ultimately doing the right thing for you and for patients, to get patients in the right place where they can receive the best care. So hopefully that's helpful, the context, because you'll be hearing a lot about what does this mean for us in terms of discharge. We've all got a real responsibility to make sure we challenge it. Is this the right setting? And work from a really multidisciplinary perspective. So, and I've seen that happening. I know Debbie's seen it happening. So just wanted to really thank you on behalf of Debbie and myself and everybody else of everything you're doing in this space, everything you're doing generally. We recognise the pressure and are hugely, hugely humbled to be kind of leading the organisation. So thank you for everything you're doing. And I'll hand over to, I think it's Mark. Oh no, it's me. Hand over to myself. So this is a slightly different thing to tell you. So essentially, as some of you may or may not know, Boris Johnson went to Moulton Park Vaccination Centre to meet some of the team, as you can see in that picture, and recognise the amazing work that's being done there to make sure we get everybody vaccinated as quickly as possible in the county. But he also asked to speak to me and other colleagues, including Matt, Alan, Simon, unfortunately couldn't make the call, but he was invited, and Mark, our Director of People across the group. And I guess we just really wanted to say that he was truly interested in what he could do, what his team could do to help us and support us. So we had a really good conversation around some of the bigger, longer term things we need to change in terms of how things work, how things are funded, how systems are supported, but also what we needed from him now. So we just wanted to share with you that he had a personal conversation with us at Northampton. We obviously shared the perspective of the group as the whole. So that's a really positive thing, that they felt our perspective was really important in the national agenda. So moving on to the next slide, which I think is Mark.
Yes, thank you very much, Heidi, and good morning, everybody. My name is Mark. I'm the Chief People Officer working across the University Hospitals in Northamptonshire on both trusts. So I've got a number of items to discuss this morning, but I am also mindful of time, as Simon has said, to try and finish us by 11:15 and allow for questions and answers too. So in terms of vaccination, as Heidi said, it's so important, as it's been throughout the course of the conversation this morning. We know that the vaccination provides a good effectiveness in terms of particularly around the Omicron variant and other variants that we've seen to date. I'm not going to go into this in huge detail. You can see the statistic. You would have seen it in many news channels that I'm sure you're accustomed to over the course of the last couple of weeks, and how important that booster jab has been in terms of preventing some of the hospitalisation that we saw previously in the previous waves in those graphs that we've seen earlier this morning. So if I could take the next slide, please. So a conversation here around mandatory vaccination for those of us who work within the NHS. So as colleagues will be aware, just prior to Christmas, the MPs voted to make it a legal requirement for those of us working within the NHS to be vaccinated against COVID-19. And that is going to become a condition of our employment. So you will also hear this sometimes be described as a vaccination on condition of deployment process too. The law applies that colleagues have to have had both the first 2 doses of a COVID-19 vaccination by the 1st of April 2022. But the really important information that I want to provide you with today, because I know many people in my teams and in other teams across the organisation are contacting people to whom we do not yet have vaccination information. It's really important for those that are not currently vaccinated that they receive their first vaccine by the 3rd of February. So that's just a couple of weeks away, 20 days, as was described to me earlier. It's really important that we undertake that people receive that vaccine by the 3rd of February in order to enable the distance and time, therefore, between then and the second dose of the vaccination before the 1st of April, and with it being a condition of employment. The reason I raise that, as I say, is because we're having many conversations, as you can imagine, at the moment, and those conversations that are coming back, whether or not it's exemptions and so on and so forth, are also with regards to, well, it's okay, I thought I've got until April to provide that information, and we really need that as soon as practically possible. And if you have not yet been vaccinated by the 3rd of February, we also have received some comments back in terms of some people feeling that have not yet had the opportunity to have the vaccine or have not undertaken it to date, that they are slightly fearful around undertaking it and going to receive it because they may well be judged or so on and so forth by the teams who are vaccinating them. I can assure you that's not the case. The teams understand we all have the ability to have chosen to do this yet or not, and they will be accommodating, of course, to any people that come forward now for their vaccine prior to the 3rd of February. We have sent letters out for people, as I've said, in terms of requesting information. It's really important that you're able to give us that information. I know we've also had feedback that some people believe that they're not in scope, so therefore that is not counted towards them at the moment. The current guidance articulates that it's for colleagues, or it's important and mandatory, if you like, or a legal requirement for those to undertake CQC regulated activity. Those who come into contact with patients or could come into contact with patients as part of their role, or those who work with colleagues who could come into contact with patients. The way my team and I know they're working very closely with colleagues across the organisation in creating scenarios at the moment. So what does that mean? Who does that mean for? The best way at the moment we can articulate it is that assume you're in scope until you are informed that you're not. And that goes along with exemptions too, because there are exemptions in terms of medical exemptions and so on and so forth. But please come forward with those and we can have conversations around that in terms of exemptions that can be applied or not. But I think it's very important. The main message at the moment, given that we are trying to ascertain the status of so many people in the organisation, is to assume that you're in scope as opposed to assuming you're out. And then we can have that conversation and provide you with that guidance as part of that, taking that information away. It's really, as I say, that we have plenty of vaccination or vaccine to provide to colleagues, and many appointments are available for colleagues to come forward and to receive their vaccination. I think they're the main messages that I wanted to get across this morning. If on this slide I leave nothing else with you, it's that it's the 3rd of February for those who have not currently had a single dose of the COVID-19 vaccine. They need to have it by then, and therefore that is why over the next week or two we need to understand everybody's vaccination status in both organisations to make sure that we can be ready to vaccinate those colleagues by then. That we are receiving, or we intend to receive, further guidance from the national team in the next couple of days as to what happens for those colleagues who do not receive both doses by the 1st of April. There is discussion around redeployment where possible, and where not possible, obviously that will affect people's entitlement to be employed in their particular roles. I know that's emotive and controversial, but that is very much the guidance that we are receiving, and it is now a legal requirement similar to that of holding a qualification for a role that we need to undertake, or registration, whatever it may be. Thank you. If I could take the next slide, please. So in terms of support, as we've articulated, we know we've had huge absences over the last couple of weeks, and we know everybody that's here is going above and beyond once more, and have been now for almost 2 years, in supporting, caring and providing care for our patients and indeed each other. There are a number of support services still in place. So I know we circulate these slides, so I'd really like you to take these away and to have a read of them, and also to share them with colleagues to make sure that people are aware of the access that we have into some of these support services that we've been able to put in place over this last recent period of time. An element that's been added to the slide, as you can see at the bottom here, is with regards to meals. So you can see that once again we have free meals. They're being deployed initially for the month of January, but perhaps further. They're being deployed, and you can go and collect them. This is something that we brought in and we had in place in the last wave of COVID, and particularly over last winter. It was something that colleagues had said to us was really beneficial for them, because it took one additional stress out of their day in terms of being able to ensure that they can obtain a meal at the end of their shift, or towards the end of their shift. And again, in coming on to shift, it was something that they had readily available, and it was one less thing they had to worry about during the course of the day. So I'm really pleased that that is now back in situ in both organisations, which is fantastic, or will be on the 17th. If I could take the next slide, please. So feedback also is really important. I know at this time, believe me, we have thought about this long and hard. So there's a quarterly national people pulse survey that we're required to undertake, and there has been a subject of debate at the moment, given the pressures that we're under. Is this the right thing to be doing at the moment? But it is really still important that we're able to obtain your feedback. We know it's a really difficult and challenging time, but next week we will ask colleagues to undertake a people pulse survey. We have stripped it right back to be 9 core key questions, the 9 mandated questions for colleagues to answer and respond to. That's taken away some of the additional questions that we may have wished to ask, but totally acknowledging the circumstances in which we're operating in. The responses that people are able to provide us to those surveys do help us to then, in terms of what further course of action could we take, what is going well, and where that is the case, can we support or provide or extrapolate that into other areas, and equally where there are challenges, what action can we undertake, and in terms of supporting people in that particular environment. So please, when you see it next week, over the 2 weeks from the 17th to the 31st of January, I know it's hugely time pressured and time consuming at the moment in terms of lots of activities that we're having to do, but if you could take the time to complete your survey, we'd be most grateful. Thank you very much, and I'm over to you, Simon.
Thank you, and thanks for the everybody who's presented. So if we can drop the slides now. As I've said, we're in a Teams format, so people are welcome to ask questions on anything that they have heard today, and would be delighted to hear from you. You can do so in the chat if you want to, which I'll try and bring up for myself on the screen. You can also, as we did last time, do so by putting up your hand and actually talking, and we would encourage people to be more conversational, because this is all about conversations, isn't it? So we would really like to hear from you if you have questions about anything you've heard today. I know some of the things that we have talked about today may feel a bit tricky, particularly the topic of mandatory vaccinations. Don't worry about raising your hand and talking about that too, because it's important that we hear your views. We recognise that we're trying to navigate a very difficult set of circumstances here, and that people will have strong views about it, but I would encourage people, if they would like to express views on that and anything else that you would wish to. The floor is yours. Would anybody like to ask us a question? And I'm going to have to, if I can't see a hand, please do point it out to me, colleagues. Andrew, and then Jane. Hi, Andrew.
Thank you. Have I moved? Yeah. Just like to point out that any of the staff who have mental health issues, they're very welcome to contact Kettering Mind. The phone number is in the book. You don't need GP referral or anything. Advice is totally confidential. You can get help, counselling and support. And of course, we are independent totally of Kettering General Hospital. I think the odd staff at Kettering may fear that if they report mental health issues, it could possibly be held against them. So anybody, there's no waiting list. If people want help, it is there for them. And we do obey all the COVID rules. You have to wear a mask, you have to socially isolate, etc., etc. Thank you.
Thanks, Andrew. You raise a really important point. I don't think there's any one of us from a mental health perspective that hasn't been touched in some way or other by what's happened over the last couple of years. And I think, include myself in that, and I think it's really important that not only do we avail ourselves of the time to look after ourselves and make use of the opportunities that Mark described, but also recognise there are partners out there in the system who want to provide that care for us as well. So if people wish, then please do reach out to Mind, who are there for that sort of help and support. It is not a weakness to say that you are struggling, it is a strength. Jane, hello.
Hello everybody. I'm just letting you know the next dates that we've got available for vaccines are on the 14th, 17th and 19th of January. We look forward to seeing you there. We're not there, as you said, Simon, we're not there to judge anybody. We're just there to support colleagues, even in making the decision if they want to come over and speak to one of our qualified nurses to find out a little bit more about the vaccine or allay any fears. And also please pop over. You know, we could allay those fears and then be able to vaccinate you. But if you don't come and talk to us, then we don't know what your fears are. So we're happy to do that as well for our colleagues.
Thanks, Jane. That's a really important point. The medicines we take and put into our body are kind of quite an intimate and kind of deeply felt issue. I've heard from colleagues who talk, even this week, I've heard from colleagues at the NGH when I went and did a visit in the gynae service about who've got very strong views about vaccines and why not. So, and I would encourage colleagues, if they are worried, for whatever reason, to go and seek the support of the teams. They are fantastic teams on both sides, and they do a fantastic job, and they will take the time to talk to you about your individual concerns, because I recognise that although we're talking about a national directive here, we're also talking about lots and lots of individuals who have different needs and different requirements and different views. So thank you, Jane, that's really helpful. Francis, I think you were next. Hello.
Will there be anything coming out to managers about which staff haven't been vaccinated? Because I don't know who to talk to, if I should be talking to anyone, and if I have to assume that people are within scope, when do I start a recruitment process?
So I think that's one I'm going to bring Mark in on, just to start with, and then any other colleagues, because there are a range of us here who can provide support or insight. But I'll come to Mark first, if I might.
Thank you, Simon. Thank you, Fru. So we're just working through that at the moment. So what we wanted to do was, and hence the letter over Christmas into the new year, was to ascertain everybody's status. So who has received a vaccination that we didn't know about or don't know about because they didn't receive it here, as an example, in either hospital site. So we're obtaining that information, and then we will be now circulating the information to colleagues in managerial roles to say, could you please have a conversation with ex-colleagues? There may be some areas where there is nobody that we need to have a conversation with. It is, as I say, in terms of percentages at the moment, we don't know that because we don't have all of the data, but we're not talking thousands and thousands of people. It will be some people in areas that we need to have conversations with. We're working that through at the moment. In terms of recruitment, I saw that also has come up in the chat. That is something that we would need to work through in terms of adverts now. So adverts will require or have a vaccination as a requirement before we recruit people into roles in either hospital site, because it's obviously mandatory that we have it now.
Thanks, Prue, and thanks, Mark. And I recognise, just in saying that, I know that we're asking of our managers to step into a space that may feel tricky. This is not something that we've done before. If people have support needs or questions about how to do that, how to raise those topics of concern, please do reach out to any one of us, to Heidi, to Debbie, to Mark, to any one of us on this call. We are all here to support you to try and have those conversations. Mark.
Sorry, Simon. Yeah, I put the virtual hand off as opposed to waving my hand in the background here. So yes, and there are a number of sessions with regards to having that conversation that are being arranged and communicated. The first one was held on Tuesday, and we'll make sure that everybody has access to know when those sessions are. We did have quite a large attendance on Tuesday just to help with those questions, that Q&A, in terms of how to have that conversation and what that should contain.
Thank you. Other questions? Anybody else got anything they'd like to raise either on this? It's fine to raise whatever you want on this and or any other thing that we have talked about today. One person raised their hand, but I can't see who the name is. It just says on my screen. Sorry, one person. Who would like to go next?
I think it's Rashmi, Simon.
Okay. Hello, Rashmi. If it's you, the floor is yours.
I wanted to ask with the exception for visiting, and I just wondered whether with people with dementia and language, I know you said can be contact with each ward and managers, but that sometimes can be quite difficult, whether there's a sort of guidance so that it's generic, so people know, in terms of visiting, so people, because sometimes it can be quite confusing.
I think that was a question on visiting and about particularly visiting people who've got dementia and some of the issues associated with that. So maybe Fiona, I could come to you for your views on that, if that's okay.
Thank you, Simon, and thank you, Rashma, for the question. You're absolutely right in regards to the needs of our patients need to be taken into consideration, in particular those patients that suffer from dementia, learning disability, for example, or patients with autism. We recognise as healthcare providers how important it is to have familiar faces of carers, relatives, patients, family around those patients. So in regards to the guidance, it is the national guidance that we have put on our website, but that's why it's important if you've got individual cases or you're aware of individual cases, and within the wards and outpatient settings, we should be aware of those individual needs of our patients and clients. Those discussions can be had on a one-to-one, case-by-case basis. But happy to take any particular queries outside of the call if that's helpful, Rashmi.
And I just want to say, just in passing, thanks. It's a really good point. Two things. The first is we rely on quite a lot of the ways in which we keep in touch or help patients and relatives keep in touch from our wonderful volunteers. And I'd just like to take a moment to thank them for the work that they continue to do to support keeping those channels of communication open. So if any of you are doing that at the moment, be in no doubt that the role you play providing that bridge, that link between people is hugely supportive and helpful and makes a real difference. And we know made a real difference in the waves that have happened previously. The second thing I'd say, Rashmi, which is just we have no desire to keep these restrictions in longer than is necessary. One of the reasons why we continue to meet very regularly is to make sure that we are not extending them beyond the time that we need to. And as Fiona said, the reason which we brought them in was pretty clear, and it is still going on at the moment. There are outbreaks in healthcare facilities that continue to happen because of the interaction with the community, and we can't take the risk of creating cross infections and then outbreaks in hospitals that follow from that. But thanks for the question. Any more before I bring this to a close today?
We have a question from Sean, or they have a hand up.
Sorry, was that a question from Sharon, John?
Sean, it looks like SAIN, Sidgwick.
Hi, yeah, it
hello.
is. It's Sean. Hi, Simon.
Hi, Sean. Sorry, I couldn't hear quite. John's voice was very muffled, so apologies for getting your name wrong. Hello.
That's fine. I've been called worse. It's fine. I was just wondering, of the number of patients that we have in Kettering specifically, because that's where I work at the moment, how many of them are actually in for COVID as their primary admission reason, and how many are in for other reasons that would have been in regardless of whether they're COVID positive or not?
That's a really good and complicated question at the moment, because that's increasingly, is COVID the primary reason, or is it incidental to other factors? Rabia, maybe I can come to you to perhaps give a clinical perspective on that, if you wouldn't mind.
Thank you, Simon, and thank you, Sean. So, the direct and the honest answer is I don't have the exact number to split it, because it's not that easy to make that distinction. But I will come back to you, Sean, with that. But what I can tell you is that one thing we are seeing more and more is the patient who are severely ill with COVID or requires ITU admission with COVID are the unvaccinated patients. So it's not answering your question directly. I will look into that number, but that's what is actually quite visible, is one of the things which vaccination is doing, is preventing that severe acute illness and ITU admissions.
Thanks. We will publish that data, Sean, just so you are clear. Heidi.
Thank you.
It was just to support Rabia, really. I don't know the exact numbers, but what I can tell you is when the numbers were rising at NGH, a lot of those were incidental. There were patients that didn't come in for COVID, were largely asymptomatic, and it was through routine testing. So a fairly significant proportion are known nationally. So we're chief execs group. Some hospitals are saying 2/3 of their COVID patients are incidental, found out as a secondary through routine testing. So it just gives you a context of our picture and some national picture.
Thanks, that's really helpful. And we know, just to conclude the picture, Sean, that the majority of the transmissions that we're seeing in the community remain in the younger age groups out there. That's how it's moving around the community. So one of the reasons why we are still being very cautious, just to conclude this and then I'll bring us to a close, is the lag effect from schools going back is something that we've yet to see in the system. And we know that there is a lag effect between changes in how the population moves around, literally, and the impact that we see on health services. So I promised that I would stop, so I'm going 2 minutes over time. So I'm going to bring us to a close. Thank you very much for all the questions today. What we'd like you to do now is to take a 10-minute break, go and have a cup of coffee, and in particular, if you think you know somebody who needs a thank you, to go and thank them. We all have people who we should thank every day. I know I do. We thought it might be a nice way, rather than spending more time here, if you had an opportunity to go and have a drink, have 5 or 10 minutes, and try and find somebody to say thank you to for the support that they've given you or the service that they've provided. So with that in mind, I will bring us to a close today. Thank you very much for being here and look forward to seeing you all again soon. Take care.
Thank you.